But basically, in terms of the Surgical MedTech Co-operative, there were 11 cooperatives across the country that sort of ran between 2018 and ending next week. And we were successful, as David said, in becoming HRCs, but there are now 14 HRCs, so we've had a few new centers that have come on board. Now, from our end, in Leeds, the Leeds Teaching Hospitals hosted 2 cooperatives, actually, which made it more confusing for everybody because only one of them was the Leeds MIC, and we were the surgical MIC. And the main difference between the two is one was diagnostics and one was MedTech, which is ourselves. So what, in the new funding round, the Department of Health changed the requirements, which meant one trust could only host one center, whereas before one trust could host a maximum of 2 centers. So what we decided to do was to merge the 2 of them together, and that will be reflected in the theme of the HRC. So in terms of successes between the 2 MICs themselves, we have leveraged additional funding for our host organizations, that's Leeds Teaching Hospitals and the University of Leeds, but we've also leveraged funding for loads of startups and small, medium enterprises. So the way we do that is we collaborate on grant funding applications, and this is where we provide the clinical expertise, we provide the patient expertise, and sometimes the academic expertise, depending on what type of grant it is. So that is the way we leverage funding. And one of the things we also are tasked with doing is increasing the size of UK PLC. So if we can get foreign companies to actually locate in the UK as well, that increases the work as well for everybody. It increases the opportunities, and it also means that the NHS has got access to new technologies as well. So you will hear from one of our speakers from Nexus, because we work very closely with Nexus for that, and we also work closely with the Leeds Innovation Pop-Up, and you hear about that as well. So what we're trying to do is also attract companies into the region. We've worked with multiple industry partners. So I think on the slide it says more than 650 companies, and that is over 5 years across the 2 MICs themselves. So we're definitely busy. People are definitely coming towards us, and this is not going to change with the HRC. In terms of projects, multiple projects again, and international collaborations. And the NHSA has been instrumental in helping us secure some of these international collaborations in terms of how they link us up with different countries and their medtech sectors. So for instance, we know we've had a few companies from Israel, for example, that have managed to secure funding in Israel to actually do the work in the United Kingdom because of the links with the cooperatives. We also have links with, through the, I think it's Department of Business, I never know what they're called. But Switzerland, for instance, we're doing some work with Switzerland as well. We've done some work with Spanish companies, and naturally you've got Canada and the United States in the mix. So we do, even though we are based in Leeds, it does not mean you have to be in Leeds to work with us. Leeds is just our legal home, basically. That's all it means, but you also get access to a whole range of expertise within that. Now, in terms of the HRC and the direction of travel for the HRC, one of the things we looked at from the work we've done through the mix is actually what do we need to do better, what lessons have we learned, and how can we transfer these into the 5 years coming up? And that is what you see at the bottom of the slide where we're looking at the barriers. So obviously companies will know a whole lot more about the regulatory challenges. And we are not claiming to solve them all, but we've got a great team in place to help startups and SMEs solve those challenges. So that is the way we're going to work. We're going to work with partners to help us solve some of these challenges. And there will be breakout sessions, and I think some of the fireside chats and panel discussions will touch upon this. It's about access to funding. Funding is really challenging, but from an international perspective, people see the UK as literally floating in money. But it's how do we access that? Because you've got to know the right funding stream, and you've got to come at it at the right stage. It's about understanding the medtech ecosystem, which is the next set of talks. So you're going to understand that particular ecosystem within Leeds. And it's also target markets. So this is about market access. So how do we make sure innovators are developing technologies with the end in sight? Because one of the things we've seen from the surgical MEC is we've got brilliant concepts and ideas that come through, but they are not things that can actually be implemented in the NHS, no matter how good they are. So we need to start looking at that process from the end to make sure that people don't waste their time. And finally, sustainability started coming up, particularly with COVID, highlighted sustainability. It highlighted the waste. So surgery is a very wasteful specialty. And one of the things we did was we started off with a COVID challenge, and then we had a green surgery challenge. So it's how can we develop sustainable products? How do we build in sustainability right at the beginning rather than at the end? So just to finish off on the mix in terms of successes, it's the job creation, as I mentioned. We've got a couple of companies in Nexus, Innovation Pop-Up, that have located themselves in the United Kingdom because of our support. As a surgical MIC, we had a £200,000 pot of proof of concept funding, and this leveraged just over £5 million. So what that means is we gave people £5,000, £10,000, and they were able to get more money as a result of that. I've talked about the Green Surgery Challenge, market access for MedTech course. So one of our chairs, Mike Branken-Harris from Device Access UK, we've run a set of courses with them, and this is really about getting companies to understand what market access looks like, particularly for the NHS, is our predominant interest. And then there's things around, finally, the last sort of success we had as the MIC is the Department of Health recently set up the IDAP, Innovation Devices Access Pathway Pilot, and two companies we were working with managed to get through that. So there's only 8 companies that got accepted onto that pilot. And as far as I'm aware, there's another MIC that got a company on, and that was diagnostics, but we're the only MIC that's actually got 2 companies, and that's Ear Switch, so they've got a standout side, and we've also got Histosonics, who've got a really fancy kit, which I really suggest you try out during lunchtime and in the evening. But it's a revolutionary kit, and it's really going to change the way surgery is done. The only thing I can say is I did go see the kit in its environment in the US, and they were quite careful to not tell surgeons they're being talked out of a job by using this thing. So we'll see what the UK feels about that. So in terms of the HealthTech Research Centre, the aims are pretty much the same as the MedTech cooperatives. The main difference is really about providing more support for market access, more support for regulatory expertise. And one thing that's also been added in is training and capacity building. So how do we help people understand what they need to do? How do we educate people on certain things? How do we increase capacity within certain environments so that the sort of lack of knowledge does not become a barrier within itself? So in terms of what it looks like as an overview, as David mentioned, MedTech Cooperative was predominantly secondary care. With integrating the Diagnostics Cooperative and the work that we're doing with the Biomedical Research Centre, we've decided to look across the entire surgical pathway. So in terms of sort of clinical technology themes, you've got theme 1 is we start off with the diagnostics. So these are diagnostics that will help surgery or that are advantageous to surgery. So it's things around, does this patient really need surgery? Are we diagnosing the right thing? It's also about how can we predict which patients are likely to have poor outcomes, either because they get sepsis or some other infection. So you'll hear a bit more about that. Theme 2 is your traditional MedTech cooperative theme. So that is where we've got the real hardcore MedTech stuff. And we've expanded our surgical areas, so mainly to include transplant surgery, emergency surgery, and orthopedics. And then theme 3 is assisted healing and rehabilitation, and this is the bit that looks at the community. So how do we get patients out back home safely and make sure they're not blue lighted back into the hospital? So we want to look at everything that surgery impacts on and introduce those technologies and get them to those markets a whole lot quicker than they currently are. These themes will be supported by academic work streams, and the first is something we're calling a surgical care observatory. Now, the best way I can describe it, as someone who understands the pharmaceutical sector well, is if you're a pharmaceutical company, you've got a process for picking the right compounds to take through to a phase 1 study. We do not have that process for the medtech side of things, so that is what we've tasked ourselves with doing, is how do we pick the winners? How do we pick the right medical technology to go through to the next stage and that we can throw all our support behind? Because what we tend to get is 50 technologies all claiming to do the same thing. Not all of those technologies can be adopted by the NHS, so we need to be a bit more realistic and a bit more strict with what we choose. The second work stream is the clinical and economic valuation. So this is more around the methodology. So it's first of all around clinical trials. It's picking the right methodology. What's the right way to evaluate these? What are the outcomes you should be looking at? What are the things you should be measuring? And similarly with health economics, it's understanding whether it's actually worth doing the work around this based on the health economics outcomes and the outputs and what the NHS is looking at. And finally, we have sustainability and NHS net carbon zero. So once again, that's looking at sustainable product development. And the NHS, for instance, I think by the end of next year, every company selling into the NHS will need to have a carbon reduction plan. And then I think after that, for each product, there's going to be some sustainability type document that's required. So we want to start building that into the process from the beginning so that it's not an afterthought and it doesn't create more work towards the end of the process. Now, in terms of patient and public involvement, it's central to anything the NIHR does. We do include patients in all the work that we do, and this is things around focus groups, for instance. So we've hosted a multitude of focus groups, mainly during the project development process, but also to support grant funding applications. So most grant funding applications want to know what the benefits are to patients. So we've got patients with a wealth of expertise that will be able to actually ask the important questions. So for example, there's a lot of digital technologies coming in. People are coming in with apps and all sorts of fancy things. But then not everybody has got the internet you tested this app on. So if you're saying that this technology is going to help a certain community, but that community also has other factors, which means they don't have that type of internet access or the type of device that you want them to use, then it's actually not equity at all. You're actually worsening the health inequality. So that's one of the things that patient and public involvement helps with, because the health inequalities piece is going to become big for just about everything. And I think this might be the final slide, capacity building and training. So we'll be looking at things around generic research training, health economics, clinical trials, sustainability and commercialization. And we also have the MedTech Foundation, which was like the junior arm of the surgical MIC with the students. And it's also about growing that foundation as well and making sure that the next generation of academics and clinicians are trained with this innovation cycle in mind. So I know that was a quick tour of the HRC. Oh, no, sorry, this is the last slide, but it's basically sort of the workflow in terms of all the things we're looking at. So that's our task now for the next 5 years. If you've worked with us before, we still welcome you back. If you haven't, we're going to be much more strict about what we let in. Because as you can imagine, I don't want to have to look at all these things that are probably not going to go anywhere. So I will, or might not, apologize in advance. You're going to have much more stricter filtering systems coming in. But that's more to do with the support that we can provide, and it's not necessarily a reflection. A rejection of us working on a technology is not a reflection on the technology itself. It's what our resources can accommodate and what outputs we can get out of that. So yes, HRC starts just after Easter. The transition will slightly be a bit slow because we need to set everything up. But I would say just continue using whatever details you have for us. Continue to follow our social media. And at some point, the names and the branding might change, might not. We'll have to see what happens after Easter.